In healthcare, preventing the spread of infection is as important as treating the illness itself. Transmission-based precautions are special infection control measures we use in addition to standard precautions, especially when we know or suspect that a patient has a contagious disease. The three main types. These precautions are tailored to how the infection spreads. We classify them into contact precautions, when germs spread by touch; droplet precautions, when germs spread through moist particles from coughs or sneezes; airborne precautions, when germs float in the air over long distances. Contact precautions prevent diseases spread by direct touch or by touching contaminated surfaces. Examples include MRSA, C. difficile, and scabies. Here's what's required. Wear gloves and gown before entering the room. Dedicate equipment to the patient when possible. Perform hand hygiene before and after all patient contact. Soap and water for C. diff. Droplet precautions protect against infections spread by large respiratory droplets that travel up to 3 to 6 feet. Think influenza, pertussis, and meningitis. Key steps. Wear a surgical mask within 6 feet of the patient. Keep the patient in a private room or with a patient with the same infection. Limit patient movement outside the room, and if transport is necessary, mask the patient. Airborne precautions guard against very tiny particles that remain suspended in the air and travel long distances. Examples: tuberculosis, measles, and chickenpox. Precaution essentials. Place the patient in a negative pressure room. Wear a fit-tested N95 respirator before entering. Limit patient transport. If necessary, mask the patient. Combining precautions. Some diseases require more than one precaution type. For example, varicella requires both airborne and contact precautions. Educating patients and visitors is crucial. Explain why these precautions are necessary, demonstrate proper gowning and masking, and reinforce hand hygiene. Why it matters. Transmission-based precautions protect patients, healthcare workers, and the community. Following them precisely helps prevent outbreaks and saves lives. Remember, standard precautions are your foundation. Transmission-based precautions are your shield. Use them wisely.